So today's topic is toddler nutrition and feeding beyond 1 year of age, and we will take fortification as well today. So it's from page number 74 onwards. If you have the textbook, Nutrition and Child Development textbook, page number 74 onwards. If anyone is joining late, please help them out with the page numbers. So toddler, that's the age we call them as a junior stage of development when the child is ready for strong nutritional foundation, and it here new experiments, new recipes, and new experiments are tried out by the parents as well to to enhance the growth and development of the child. Okay, here the child, a toddler, will definitely require much more high energy dense food as compared to the adults as well. Okay, just wait for 1 minute. Yeah. So toddlers, healthy eating is important for toddlers, providing them high energy food as they require high energy food as compared to adults. Okay. Yeah, these recordings are available as well on the link. So in toddlers, high energy food is required. The energy requirement per kg of their body weight is much higher than adults. Okay, so but the portion size will be smaller, but the energy requirement per kg body weight for toddlers is higher than adults. Okay, they require high energy food, nutritious food for their growth and development. Encourage them the food, it should also encourage their developmental skills like touch, smell, taste, and vision. So food should, the whatever you serve the toddler, okay, it should be appealing for them. Okay, in the sense of touch. Okay, they should like to touch the food, they should like the smell of the food, the taste of it, the vision of it, the colors of it. Okay, so it enhances their developmental skills as well. Establish healthy eating behaviors that last for a lifetime. Okay, the kind of behavior you are able to establish for toddlers in this particular age group of 1 to 3 year of age. Okay, that healthy relationship with the food, it is long lasting. Okay, and also important psychomotor developments will also take place in this particular age group, like grasping, reaching out for things, holding things and releasing things. Okay, and nearly fully they get fully mature about this age by the end of the 3 years of age. Their coordination, their gestures, okay, elbow lifting, talking, using phrases, words, forming sentences. Okay, they all take place in this particular age group. So omega-3 fatty acid, DHA rich food should also be included in their diet. Some of the important issues that comes with feeding the toddler, some of the nutritional issues that we see. Although most toddlers are well nourished, a minority have certain nutritional problems that can have immediate or long term harmful effects on their health and growth and development if the parents are not careful. Okay, And iron deficiency is common in toddlers who eat poor diet, because and it can lead to anemia and delay the development. Not just because of poor diet. If the child is born with very less amount of iron stores because the pregnant mother during her pregnancy was anemic, okay, that could also lead to poor iron stores in the child who is born. And with this poor iron stores, when the child is developing in the infancy and still you're not giving them iron rich food, it would definitely lead to anemia. Okay. Vitamin D deficiency is also seen mainly in dark skinned children in UK and other parts of India as well. Toddlers who do not have sufficient exposure to sunlight, or who are just kept inside the room, they're not allowed to play outside. Okay, or they do not take vitamin D supplement or growth supplements. Okay, for them it could lead to rickets as well. Dietary fiber, omega-3 fatty acid may be inadequate in diet for some toddlers, and that could lead to uh, delay in psychomotor development. Okay, delay in neuro and the brain development. So foods containing fish oils, or for at least foods fortified with omega-3 fatty acids, should be used. Growth faltering. Growth faltering is means delay in growth, not able to catch up with their peers. Okay, that is growth faltering is usually due to inadequate dietary energy intake. There is rarely a serious underlying medical cause because of which is leading to developmental delay. It's usually because of the nutrition is not good. If the child is not keeping up with their peers, it is usually because the nutrition is not good. Tooth decay in young children may be due to poor oral hygiene, unfluoridated drinking water, access of simple sugars used in the food, having too many chocolates, having too much sweet things to eat, okay, and having a habit of eating something sweet or snacking throughout the day. These could lead to tooth decay. Many toddlers do not shed their puppy fat, that is that chubbiness the child has. Usually children are born with a specific kind of chubbiness that is called puppy fat, and even when they get older and the lifestyle does not changes, that they may lead to it may lead to the children becoming overweight or obese. Usually by the age of 3 or by the age of 5, the puppy fat that the child is born with should be lost. That is, that excess chubbiness that the child is born with should be lost. The skin should become more taut, and musculature should start developing. The flexibility of the body should be developed. Okay, but if it is not happening, there are high chances that the child will stay obese or become overweight in the future. Constipation can be distressing for young children and may be due to low intake of fluid or low fiber rich food. That could also be the reason of constipation. Usually, the children are dehydrated. They do not understand thirst mechanism. They do not know that when they are feeling thirsty and they should be asking for water. Okay, they are not aware of this, and that could lead to constipation. Allergic disorders are increasing, but before you try to take away a food component, just thinking that your child is allergic to it, it's always better to get a diagnosis of the or get a proper list of allergies, do the allergy test and all, get the proper list of allergy that the child actually has, and only after that remove the food components. Before doing this diagnosis, before getting a medical evaluation done, do not remove any food components just thinking that your child may be allergic to it. Coming to the nutritional requirements of toddlers between 1 to 3 years of age. So approximately whom do we call a toddler? It is a child who is between 1 year to 3 years of age, 12 to 36-month old. That is what we call as a toddler. In different countries, this definition may vary, but usually 1 to 2 years or 1 to 3 years is what we call a toddler, or it is called late infancy. Infant means the child from the day 29, okay, from when the 1 month period is over, soon after birth. When the child is within that 1 month period, soon after birth, the child is called a neonate or newborn. As soon as the second month of the child's life begins, from that second month till the first birthday, the child is called an infant. After that, the child is called a toddler. So major developmental milestones will be achieved in this particular age group. Here the child witnesses rapid physical growth, muscle development. This is where the puppy fat has to be lost. Muscle development begins. Maturity of the immune system, because breastfeeding is still being continued. Cognitive development, social development, motor development, coordination between the hands, legs, okay, constant increase in the physical movements day by day, okay, day by day they are getting more active and active. So these are the developmental milestones that takes place. And again, nutrition plays a very important role when it comes to this rapid growth and development of toddlers. And any deficiency of nutrition in this stage can trigger some consequences that can affect the child for the rest of their life. So, what things you should take care of when you are feeding a child who is 1 to 3 years of age? The portion size, when it comes to calories, we are not talking about calories right now because portion size is important. So, what is the portion size the child should have? More than half the food that the mother eats. Whatever is the quantity of the food that the mother is having, just a bit more than the half of it. Okay. If the mother is having 3 chapatis for her breakfast or 3 chapatis in the lunch, the child should have at least 1.5 or up to 2 chapatis for lunch. Okay. So that is more than half the food that the mother eats. That should be the portion size for the child. And this portion size, if in one meal or one go the child is not able to complete 2 chapatis or 1.5 chapatis, frequent meals has to be given, and in frequent servings you have to complete this portion size. Make sure that the parents are in tune with responsible feeding. That means be oriented with your child's hunger cues. If the child is irritated, causing tantrums for no reason, crying for no reason, being overactive for no reason, acting out of nature for no reason at all, these could be usually the cues of hunger. The child may do not know how to address hunger. Okay, the child does not know what he or she is feeling is what they call as hunger, and he or she should ask for food. The child may not be having this awareness, so they try to act out. Okay, every child is different. Some children, they cry, they act out, they show some tantrums, or some children become very silent, okay, moody, gloomy. So you have to understand your own child's cues, and as soon as they are doing all these, they are showing these symptoms of hunger, immediately you have to start feeding them. That is responsible feeding. Then group feeding or group eating, eating with the family, and making sure Akshaya Patra is the bowl that never gets empty. So what happens in Akshaya Patra, at the same time you will not put all the food that the child has to finish. Slowly, bit by bit, pieces by pieces, you will put chapati pieces and some sabjis and curries into this big bowl. The child will try to finish it before it gets over. Add some more things like nuts or paneer or whatever you have prepared, finger foods or something like that. The child will finish it, and slowly, as soon as that also is coming to end, immediately add the third category, fourth category, and so on. That is Akshaya Patra, the bowl that does not, the plate that does not gets empty. So in this way, the child is not overwhelmed. If you give everything, the child has to finish within a meal in a single plate, the child may get scared of it. The child will again show some tantrums to just to avoid eating it completely. But slowly, one after the other, you are putting bits and pieces of food into the bowl. The child feels it easy to complete. Okay, and it's like a play for the child as well to complete it. So that is Akshaya Patra technique. Okay, and make sure that the child has their own favorite plate or favorite bowl, something like that. Usually children prefers that. If you give them in some new plate or bowl or any utensils, they will not like it. But if it is about their favorite cartoon character, okay, whatever favorite cartoon the child watches on TV, okay, buy the same platings or utensils of that particular cartoon character, and then the child will feel more attached to the food that is given in that particular vessel. Okay. Comfortable seating. The child should be comfortable wherever you're giving the food. It should not be noisy. It should be a calm, soothing environment. Not too many distractions. Make sure 5 times a day you feed the child 5 colors, 5 different colors, 5 different food groups in rotation has to be fed to the child. KFC, here KFC means Kids Food Corner. So teach the child that this is where you eat food. So whenever the child is hungry, and when the child is about to show some tantrums, when the child learns that this is the area where nothing else is done, but the child gets food, the child will directly may direct the parents towards that corner so the parents can understand the child is asking for food. So this is also one technique where you are feeding the child. Don't do any other activity there, for example watching TV or letting the child play with smartphones. Don't do any such activities there. There should be a specific corner in the household where which is meant only for the child to sit and comfortably eat. Okay, so whenever the child is hungry, the child can directly go there and give you the cue that it wants to eat. 1 second. Am I audible to all? Is my screen visible? Am I audible to all now? Okay. So this is the kids' food corner, a corner in the household where the child is only supposed to eat and nothing, no other activity should be done there. So whenever the child is hungry, the child can direct the parents towards this food corner, and the parents will understand the child needs food. Okay, so that is another cue. Make sure you continue the breastfeeding till 2 years or even beyond that. Breastfeeding can be continued. Breast milk can also give that as extra energy boost the child requires. Protein and micronutrients can also be given to the child through breastfeeding. 2 meals, 2 snacks. Two meals, 2 snacks plus breastfeeding. Okay, this should be the diet for a toddler who is 1 to 3 years of age. At least 500 ml of breast milk should be given to the child by the second year of life. The nutritional requirements of preschool children, that is children who are between the age of 3 to 6 years. Okay, so the quantity of the food should be at least half of what the father eats. For a preschool child, quantity of the food should be at least half of what the father eats. For toddlers, it is a little bit more than half of what the mother eats. For preschool children, half of the food quantity of what the father eats. They should be coaxed to eat variety, like not force them, but they should be encouraged to eat more variety. Some children may have an attachment towards certain kind of food and certain peculiar choices of food. For example, some children, they just want rice and curd and some pickle. That's it. Every day they just want that. You give them something else for a change, they will reject it. Okay, so in this kind of situation, try to encourage more and try to expose the child to more different kind of food items. Don't force them into it, but try with more exposure to different food items. Okay, again, group eating and supplementary feeding from the Anganwadis, ICDS Anganwadi, Integrated Child Development Scheme Anganwadis. Anganwadis have packages, food packages given to children, to lactating mothers, teenage girls. Okay, for various ICDS programs distribute their supplementary food through Anganwadis. So Anganwadi facility can be availed for supplementary feeding for children as well. Okay, but keeping up with it is a bit quite difficult, supplementary feeding, because of the cost of it. ICDS is free for the those who are availing ICDS program. It is free for them, but to keep up with the supplementary food from the management side, it is difficult. And also patient compliance or the public compliance is also weekly, twice or thrice the child may go to Anganwadi. The other 4 days, if the child is absent. Okay, if the other 4 days the child is absent in the Anganwadi, the supplementary feeding is lost. Okay, so group eating, try to make sure that the child eats with the family or friends Okay, so specifically in Anganwadi, if the child is eating food with the friends, more exposure to variety from different households will also encourage them and encourage the child to try new things at their own home as well. Fruits and vegetables should be given to make sure that you get a good supply of vitamins and minerals. Small, regular, nutritiously dense, energy dense meal should be given. Do not overfeed the child. The child will tell you how much to feed. 3 meals and 3 snacks at least should be maintained. By this time, breastfeeding is stopped completely. So 3 meals and 3 snacks on a daily basis has to be maintained for the preschoolers. 110 kilocalories per kg body weight is what you maintain, and which is higher than what an adult requires. Compared to adults, we just require 40 kilocalories per kg body weight. The requirement for a preschooler is more than double to that of what an adult requires. And also the protein content, the protein requirement of the toddler is also slightly higher than the adults. Fat requirement is also slightly higher because energy requirement is higher. Definitely, you can add more fat into the diet. Just add a teaspoon of ghee or any virgin coconut oil. Any cold pressed oil can also be added at the end of the cooking recipe before serving the child. Iron requirement is also higher in children, in preschool children as compared to adults. Vitamin B12, vitamin C requirement is also double in children as compared to adults. How do toddlers learn about food? As usually when children grow into toddlerhood, they will have a specific likiness towards specific food. They will choose their own food. Okay, what to eat, when to eat, how much to eat. Okay, these kind of behavior the child will learn from others, from their parents. Okay, and what the parents are doing, the child will try to mimic that as well. So familiarization, make sure that related exposure to a particular food helps to learn about taste, texture, or appearance. Before you give something to the child, make sure the child is familiar with the texture of that food, the taste, the smell of that food. Okay, if the child is familiar to that because this is what the parents eat on a regular basis, the child has seen this preparation again and again, so that becomes a familiar recipe. Okay, so the child is happy to try it and comfortable to try it. Observational learning. Usually, the toddlers will follow the eating behavior of the adults in the family, parents in the family, and they will develop their own habits around what they are seeing around themselves. Associative learning. Toddlers usually like to associate food with some or the other flavors. For example, if they do not like something spicy, okay, and everything that is related to red color, okay, red colored food, even if it is sweet, the child will try to avoid it. Okay, if the child does not like tomatoes, anything that is ketchupy or anything that is tomato colored, the child will automatically avoid it. That is associative learning. Okay, the child will associate the specific food. Sweets can be given to the children. Preschoolers can definitely have sweets, but do not overdo it. Okay, limit the sweets because they are also at the risk of developing tooth decay. Categorizing food. Usually, the child themselves will rank the food based on their likes and dislikes, texture, color, etc. Flavor profile will also they will categorize the food. These are the categories of food that I like. These are the things that I don't like. So they themselves will categorize their food as well. Flavor bridge. The transfer of flavors from mother to child. This we have discussed in the previous class. Even the child is able to taste the amniotic fluid. The amniotic fluid also has a flavor profile. So whatever flavors the mother used to love during pregnancy, the child will also have the same likingness towards that kind of flavor. Okay, whatever flavors the mother disliked during pregnancy because of some specific morning sickness or any other reasons. Okay, whatever flavors mother disliked, the child will also dislike the same flavor while growing up. Okay, so that is the flavor bridge. Coming to the learning mechanisms of toddlers, an entire table is given, table 6.3 on page number 80 and 81. So here, first is the causes of characteristics of family meal. Okay, what are the why is the family meal like this? For example, if the mother is preparing a lot of ready to eat stuff, there are high chances that it could be a working mother. She may not have enough time to make an elaborate meal, or she does not have adequate help in her household that could help her prepare elaborate meal for the child. So she may depend on various ready to eat food and nutrition for the toddler. Okay, so what is the characteristic of the family? What is the work culture in the family? What is the ethnicity of the family? Okay, is the family stressed out? If the family is stressed out, automatically the kind of nutrition made in the family will also be affected. Okay, so these are the causes that declares what kind of family meal is going to take place in this life. Okay, so that will lead to time, rule, social interaction. If the parents are too busy in the morning, usually they will try to skip the breakfast, or they will just manage to put something ready to eat, something for the child. Okay, something that is easily blendable, makeable, scrambled eggs, something like that for the child will be made early in the morning. So based on the timings of their timings, whenever the parents are free, and what kind of social interactions they have at home. Okay, these all rules will also signify what will be the family meal time, what type, what kind of quality is there in the family meal time when everyone is sitting together and having food. Are they fighting? Are they relaxed? Are they enjoying the food? Do they have various variety on their table? Okay, or is it something easy to do, easy to cook? Okay, variety is there or not? The child will try to notice all this stuff. Okay, these kind of information is registered into the child's observant uh, uh, mind. Okay, and slowly the child will learn the mechanism during family meal. When the child is looking at the parents, okay, what kind of behavior the parents are showing. Okay, are they fighting on the table, on the dining table? Are they relaxed? Are they stress free or stressed out? Okay, are they distracted by TVs, smartphones, etc.? Okay, if the parents are distracted by because of smartphones or TV, the child will also try to ask for some toys, some distraction. Okay, so the child will start to learn and mimic the parents and the caretakers on the while they are on the family meal. So observational learning, associative learning, familiarization, categorization, which we have discussed just right now, how the child learns about food. Okay, these things will be active during the family meal time. Okay, they will observe what the parents are doing. Okay, and they will do their association, their own self association. They will associate good good food with specific texture, bad food with specific texture, good food with specific color, bad food with specific color. Bad in the sense they perceive it as bad. They may don't like the flavor profile of it. Okay, they familiarization every day. The rice is being cooked in the family means the child will be very comfortable and happy when rice is made. And one day, if you do not make rice at all and you make chapatis, the child may show some tantrums that day. Okay, categorization, the child has already made up the category. Rice is what the child likes most, but the flowing curry, vegetable curry is something the child does not like. Hardly few drops of it only the child will eat. Okay, some children have this behavior. They only eat rice and with pickle or some or with curd. They will eat only rice, but as soon as you pour some curry on the rice, they will completely reject it. So that is categorization. Okay, and finally it leads to health benefits if there are good learning mechanism, healthy learning nutrition and food mechanisms on during the family meal time, the child will have its health benefits. Otherwise it will go the other way around. Okay, so this is a learning mechanism of the toddler. In detail they have mentioned in the uh, textbook, like the willingness to try food. The more and repeated exposure of a specific recipe or meal you do in front of the child will have the willingness to try it. Okay, the first day, second day, the child may reject. The third day, again, you bring up the same meal, the child will be a little bit more open to try it at least. Okay, and acceptance of a specific food. Again, repeated exposure, associative learning, observational learning is also having will play out here. If the child dislikes the food, that is also observational learning. If the father doesn't like pickle, if the father doesn't like omelette, the child will also start see that what the father likes, what the father does not like, what is there on the father's plate, what is there on the mother's plate, what do they like, what do they do not like. Okay, that they will try to mimic. That's observational learning. A new complex texture, something new, or new texture, porridge, pudding, something like that. Okay, more you expose the same food again and again in front of the child will be open to try it. Okay, so that you will learn from the table 6.3. Some tips for the parents and caregivers, what things they have to focus on. First, the parent has to be a role model. Toddlers usually observe and learn the eating habits of the parents, and do not dislike the food in front of the children, even if you do not like the food. But try to enjoy that particular food so that the child does not have a negative negative behavior towards that food. And schedule regular meals and snack times. Put the child on a food timetable. That is better, because toddlers do not become very hungry or tired, and if they overeat the snacks, and they will not become hungry at all for the meal time. So if you are planning your meal time and snack time in advance, it is easier to fulfill the nutritional category requirements of the child. Make time for family meals together. At least one meal a day should be a family meal. Frequent family meals are associated with greater consumption of healthy food. As parents, one should know the difference between nutrient dense food and energy dense food. Both are completely different. Energy dense food, for example, all the junk food are energy dense food. They give you high calorie, but they are empty in nutrition. Okay, nutrient dense food, they will give you energy also, but even if they're giving you limited amount of energy, they can provide at least all the nutritional requirement. You can make any food, any nutrient dense food into energy dense food, but you cannot make energy dense food into a nutrient dense food. Suggest what to eat, when to eat as a parent, but let the child decide how much to eat. The portion size, let the child decide how much to eat and when to stop eating. Okay, but what should be on the, you can select the options the child should have. Let the child have the choice, but you should be the one, the parent should be the one who is creating the options for the child. Okay, appropriate portion sizes of the meals and snacks based on the child's age and requirement. Repeated exposure of new food or rejected food, such as vegetables, etc., will promote the more acceptance and preference of those food for the children. And make sure you avoid distractions like TV, toys, smartphone, and other children who are playing nearby while the child is eating food. And make sure you involve the children in food shopping and food preparation. Okay, make sure that their inputs, their opinions are valid, so they have a positive association with food. Eating slowly, but not more than 30 minutes. Do not rush the child into eating, otherwise it may lead to some choking hazards. Okay, so do not rush the child. But if the child is taking more than 30 minutes to finish a meal, that is also problematic. So within 15 to 30 minutes, the child has to be done with the meal. Drinking water, encourage the child to drink water frequently. So that's about the nutritional requirement of toddlers and preschoolers. If you have any queries, you can mention in the chat box.